So to follow on from yesterday's video, we had a few questions come back on how does insulin resistance work at a chemical or a mechanical level. So just to answer this and touch base on the subject, again, what insulin resistance is. Insulin resistance is a state in which the body's cells become less responsive to the effects of insulin or the insulin hormone. It occurs when the normal signaling pathways involved in insulin metabolism are disrupted. Several factors can contribute to insulin resistance at a chemical level or mechanical level. So number one is increased adipose tissue. So excess adipose tissue, particularly in the abdominal region, releases pro-inflammatory chemicals called adipokines. These adipokines interfere with insulin signaling, leading to insulin resistance. Number two, inflammation. So chronic low-grade inflammation in the body can disrupt insulin signaling. Inflammatory markers like C-reactive protein or CRP and cytokines interfere with insulin receptors, impairing insulin-mediated glucose uptake. Lipotoxicity. So elevated levels of free fatty acids in the blood, often associated with obesity and high-fat diets, can lead to lipotoxicity. Excessive fatty acids inside cells can interfere with the insulin signaling, disrupting the normal glucose metabolism. Number four, dysregulated mitochondrial function. So mitochondria are responsible for energy production within the cells. Dysfunction of these energy factories can impair insulin signaling pathways, leading to insulin resistance. Number five, post-receptor defects. So insulin signaling relies on a series of protein interactions and a phosphorylation of events. Any disturbance in these processes can disrupt insulin signaling, cascading or causing insulin resistance. Number six, genetic factors. So certain genetic variations can predispose individuals to insulin resistance. Mutations in genes involved in insulin receptor signaling, glucose transporters, or insulin secretion can affect insulin metabolism. Number seven, hormone imbalance. So hormones like cortisol, growth hormone, and glucagon, I think it's called, can interfere with insulin actions. Increased levels of these hormones, often seen in conditions like chronic stress or hormonal disorders, can disrupt or contribute to insulin resistance. Overall, insulin resistance is a complex condition with multiple contributing factors at a chemical level. It often arises due to a combination of genetic, lifestyle, and also environmental factors.